Hello friends, welcome back to my channel. Hope you all are well and doing good. Today I'm going to talk about a medical condition named bronchitis and asthma in children. Nowadays, because of air pollution, coughing become more common in children. Generally, we cannot take it seriously, but sometimes coughing is a symptom of underlying disease. So, it becomes necessary to diagnose whether coughing is due to some allergic reaction or by some serious medical condition. But it is really very tough to differentiate whether the coughing in your child is due to some allergy or due to asthma or bronchitis. So I make this video so that parents and people get aware of all these conditions. So let's start our topic. Now, what is bronchitis? Bronchitis is an inflammation of the bronchial tubes, the airways that carry air to your lungs. Bronchial tubes are the internal structure of respiratory tree and it allow exchange of air in the lungs. Bronchial tubes हमारे lungs के अंदर वो पार्ट होती हैं जहाँ से हम एयर एक्सचेंज करते हैं सांस लेने के लिए. When inflammation occurs in these bronchial tubes, the condition is named as bronchitis. Here in this diagram, you can see that uh, there is a normal bronchial tube figure which shows that your bronchial tubes lined with a thin layer of mucus and there is no inflammation in the bronchial tube wall. Whereas in the second diagram of the bronchial tube with bronchitis, you can see that there is an increased amount of mucus within this bronchial tube will result in the inflamed bronchial tube wall and this condition is termed as bronchitis. Basically, ब्रॉन्कियल ट्यूब्स के अंदर स्वेलिंग होना, इन्फ्लामेशन होना ब्रोंकाइटिस कहलाता है. नाउ ब्रोंकाइटिस is of two types, acute bronchitis and chronic bronchitis, which is also named as allergic bronchitis. As we all knew that bronchitis is of two types, acute bronchitis and chronic bronchitis. Now let us try to differentiate between these two types of bronchitis. If we talk about acute bronchitis, it usually comes on quickly and can last for 3 to 4 weeks. It may produce clear yellow or green mucus and further classified as viral or bacterial. It is also named as chest cold. And if we talk about chronic bronchitis, it is rare in children and is a persistent disease that comes slowly over the time. It is a disease of lower respiratory tract and defined by productive cough that lasts for 3 months and more. Productive cough produce clear and white mucus. Cough is sometimes called smoker cough because smoking is the most prominent reason of having chronic bronchitis. As I said, chronic bronchitis is a rare disease in children, but according to the national statistics, over 2.5 million children have chronic bronchitis. There are several factors of bronchitis in children. If we talked about causes of acute bronchitis, viral infection, bacterial infection, certain environmental factors like air pollution and chemical fumes are the causes of acute bronchitis in children. Besides this, premature birth, if your child has a gestational age of less than 36 weeks, then he or she may be more prone to bronchitis in future. If your child has certain heart or lung conditions from birth, then he or she is more prone to bronchitis. Weak immune system, smoking, lack of breastfeeding, low birth weight, fungal infection, chronic aspiration. Chronic aspiration is a condition where some secretion or food material uh, enters into the larynx and trachea and can descend into lungs, causing acute and chronic inflammatory reaction. Gastroesophageal reflux, air pollution, dust, pollen, and chemical fumes are the causes of bronchitis in children. Most of the parents or people have doubt or query when they come to know that if their child have bronchitis. uh, Coughing is the main hallmark symptom of bronchitis. Children infected with bronchitis make wheezing sound as they cough. In early stages, child may show symptoms of common cold like sore throat, congestion, running nose, chills, chest pain, mild wheezing, and slight fever, which eventually turns into dry cough, producing greenish or yellowish mucus. Now, the question arises when we have to consult with doctor. Acute bronchitis usually get better on its own in 3 weeks. If it does not, it is important to consult with doctor for future treatment and investigation. However, acute bronchitis will not cause any severe complication, but in some cases, it may lead to pneumonia and chronic obstructive pulmonary disease, that is your COPD. If your child has frequent bouts of bronchitis and certain risk factors, their doctor may want to look into other lung conditions like chronic bronchitis and asthma. Most of the people get confused whether asthma and bronchitis are same medical conditions or they are different. So, like bronchitis, asthma is a lung condition that can cause breathing difficulties, and asthma can also cause inflammation of the bronchi. When bronchitis and asthma occur together, their symptoms overlap and the condition is known as asthmatic bronchitis. Now, if we talked about the symptoms of asthmatic bronchitis, it may include coughing, excess mucus production, wheezing, and shortness of breath. Asthma often starts during childhood when the immune system is still developing. Viral infection and exposure to allergens such as cigarette smoke as young baby or child can raise your child risk of developing asthma. Having parent with asthma also raises child risk. Some people also develop asthmatic bronchitis because of a change in weather or exercise routine. Doctor will diagnose bronchitis, asthma on several factors. First one is medical history and description. The healthcare provider will ask about any history of breathing problem your child may have, or as well as your family history of asthma and allergies. X-ray of chest, lung function test, pulse oximetry test, and sputum samples are also taken to look for viral and bacterial infection. Pulse oximetry test helps in determining the quantity of oxygen in blood. Usually, children younger than 5 years are unable to perform pulmonary function test, so doctors rely on history, symptoms, physical examination in making diagnosis. Prevention is always better than cure. So, if we talked about the prevention and cure of bronchitis, washing of hand is must. Your child should wash his or her hands often with soap and water, and remind your child not to touch his or her eyes, nose, mouth unless he or she washed hands first. Always remind your child to cover his or her mouth while coughing or sneezing to prevent the spread of the germs, and get vaccinated your child with a flu vaccine each year as soon as recommended, usually in September and October. However, there is currently no cure for asthma in children. Children doctor will help you to learn to control it by avoiding triggers, giving medicines, and keeping eye on symptoms. If we talked about the treatment for allergic and asthmatic bronchitis, the first one is the use of bronchodilators. Bronchodilators are the medications that relax the muscles around the airways. As the muscles get relaxed, the airways dilate and widen. Usually, people take bronchodilators through metered dose inhalers, in general known as MDI. Second are the use of steroids. Steroids may also used to treat allergic bronchitis. Steroid decrease inflammation in the bronchi. This action reduces coughing and may help in airflow in the lungs. The third one is use of mucolytis. As the name suggests, mucolytic drug is medication that makes the mucus thinner and less sticky. This making it easier to expel mucus from lung by coughing. People can take mucolytis either orally or through a nebulizer. The fourth one is your oxygen therapy. In some cases, allergic bronchitis can interfere with efficiency of oxygen flow into and out of the lungs. People with severe allergies or allergic bronchitis may have decreased level of oxygen in the blood. If oxygen level are low, doctor may prescribe oxygen therapy. And fourth one is pulmonary rehabilitation classes. It involves supervised exercise along with the education on how to breathe better and manage allergic bronchitis. With this, I'm ending this video now. Hope this video is useful for you people. Please like my videos, share them with a peer group and subscribe to my channel. Till then, bye bye.